Hello, my name is Dr. Dewan S. Raja. Today I will discuss about pericardial effusion and also cardiac tamponade. We'll find out the differences between pericardial effusion and cardiac tamponade. First start with pericardial effusion. What is pericardial effusion? By definition, pericardial effusion refers to the accumulation of excess fluid in the pericardial sac. Pericardial sac is a sac between the visceral layer of the heart and the parietal layer, serous layer of the fibrous pericardium. So serous pericardium has two layers. One is parietal layer, another one is the visceral layer that is also called epicardium. The space between them is the pericardial space. So if there is any collection of fluid, we call it pericardial effusion. Normally, it contains a few milliliters of serous fluid. So if there is more than that, then it will be pericardial effusion. Severity. The severity depends on the amount and rate at which the fluid accumulates. Similar, small or slowly developing effusion may not cause immediate symptoms and can sometimes be asymptomatic. So a person may walk and do his daily activities, even he is not aware of his pericardial effusion. So it may be asymptomatic initially. Then we'll have symptoms like chest pain or discomfort, shortness of breath, fatigue, cough, palpitation. So how can you diagnose pericardial effusion? Pericardial effusion is diagnosed by chest X-ray, CT scan, MRI. What is the treatment? Depending on the underlying cause. What are the causes of pericardial effusion? It may be due to infection, like bacterial infection, maybe due to tuberculosis. There is also a type of bacteria. Fungal infection, viral infection. It may be autoimmune mechanism. It may be due to hypothyroidism. So there are many causes of pericardial effusion. It may be due to the adverse effect of some medication, particularly some antiarrhythmic drugs. Small asymptomatic effusion may just be monitored, while large or symptomatic effusion may require medication and or drainage like that of pericardiocentesis. Okay, so we may need pericardiocentesis in case of large pericardial effusion. Okay, we need medication. Suppose a person has infection like tuberculosis, he need anti-TB drug. He has other bacterial infection, he needs antibiotic. Okay, if it is due to fungal infection, then antifungal drug. Okay, so depending on the situation, but we have to know that some medication has adverse effect. Those drug may cause pericardial effusion, like some antiarrhythmic drugs. So this is the chest X-ray of a person with pericardial effusion. We are seeing very large middle mediastinum. The heart is inside it and it is surrounded by fluid inside the pericardium. It looks like a bottle, so a bottle sign, water bottle sign will get it in case of large pericardial effusion. So we'll go to the cardiac tamponade. Cardiac tamponade is a medical emergency that occurs when fluid accumulates in the pericardial sac, becomes so severe that it compresses the heart. So there is rapid collection of fluid in the pericardial sac, and that is so rapid it will compress the heart, particularly the thin wall part initially, like that of the right atrium, then right ventricle, left atrium, left ventricle, depending on the thickness of the wall of the heart. So it is just the fluid collected very rapidly and it is compressing eventually the entire heart. So what is the difference between pericardial effusion and cardiac tamponade? In both situations, the blood or other fluid, or maybe other than blood, serous fluid, may be collected inside the pericardial sac. That is true for both pericardial effusion and cardiac tamponade. But in cardiac tamponade, it is a repeat collection of fluid. Suppose a person involved in road traffic accident or person got a stab injury or gunshot injury to the chest, then it may cause cardiac tamponade, or sometimes after the myocardial infarction, heart wall may be ruptured, so there may be rapid collection of blood inside the pericardial sac that will lead to cardiac tamponade. So key difference, pericardial effusion, fluid buildup may be or may not cause symptom. It may be asymptomatic. Not always an emergency. The pericardial effusion, cardiac tamponade, life-threatening condition due to significant pressure on the heart from fluid buildup inside the pericardial sac between the parietal layer of serous pericardium and visceral layer of serous pericardium, leading to compromised heart function. How can you say? The pulse will show the features like pulses alternans. There will be enlarged jugular vein. There will be distant heart sound. Okay, so and there will be hypotension. These are the features of cardiac tamponade because there is a rapid collection of fluid around the heart, compressing the heart is failing. So these are the features of cardiac tamponade. Leading to compromised heart function, and it required immediate intervention like pericardiocentesis, even pericardiotomy or pericardiectomy by the specialized physician to do so. And that's all about the pericardial effusion and the cardiac tamponade and their differences. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel and please subscribe me. Have a nice, wonderful, and blessed day. Bye now.